Hello, ladies and gentlemen. Welcome to Florida Tech Scuba Club's speaker series. My name is Ernesto Vega. I'm the founding president of Florida Tech Scuba Club. We are a student organization here at the Florida Institute of Technology, located in Melbourne, Florida. As part of the speaker series, we have some of the brightest and most prominent luminaries within the world of scuba diving, scientific diving, adaptive scuba, and ocean exploration joining us. And tonight is no different. We have Dr. Tania Santiago Perez, who's going to be sharing her work on adaptive scuba and utilizing scuba as a therapeutic modality and intervention for treating symptoms of PTSD and other cognitive and physical disabilities, as well as improving physical, mental, and psychological and social health. And so without further ado, I turn it over to Dr. Santiago.
Soon to be. I'm not yet. I'm graduated in December, so I keep telling him I'm not a doctor yet. I will be, if everything goes well, in December. But thank you for having me. So I have prepared a PowerPoint, so I'll share it. Let me know if you can see it, and then we'll get started. Can you see the PowerPoint? Thumbs up if you see it. Awesome.
Yes,
okay. So again, my full name, Tania Santiago Perez. I am recreational therapist by training. I'm doing my PhD now also in recreational therapy, but I teach at Florida International University. So my PhD is in Clemson, but I work at FIU. So in terms of why is adapted scuba important, I wanted to start with an activity that will require you to interact a little bit. So if you can close your eyes and imagine two bodies diving in the ocean recreationally, and just spend 5 seconds picturing two divers enjoying the ocean. So can anybody tell me if the divers that you pictured looked anything like that? Were your divers male or female? Or do you think of something else? Can you tell me? Anybody?
Mine were androgynous, like unclear as to what they were, just shapes of people.
Your shapes of people, that's good. So anybody else?
Just two standard human 3D models in my case.
Humans. So that's pretty good. So usually when I do this activity, people usually picture a fit person in their 20s to 40s doing diving. And I just wanted to share that adapted scuba diving is important so people with disabilities can access and participate and be included. So the main reason why adapted scuba is important is so we can address issues of diversity, equity, and inclusion. And this is just a quote from one of my friends, Kay, who said the only barrier in scuba should be the barrier reef. So that people should not experience barriers to participating in scuba diving when they are trying to get into this activity. So with that, I wanted to share what is adapted scuba diving. So adapted scuba diving is scuba diving that involves the successful participation of people with disabilities. And when we say disabilities, we could refer to people with cognitive, neurodevelopmental, or physical disabilities, or even social disabilities. When you think about cognitive disabilities, you traditionally think of people with intellectual and developmental disabilities or learning disabilities. Then cognitive, we usually say people, can you hear me? Because I feel like I'm breaking up.
Yep.
Yeah, we can hear you just fine.
But my video feels like it's freezing, but just let me know if you don't hear me. And then when we say neurodevelopmental disabilities, that's usually people with autism, cerebral palsy that had any limitation during the developmental period. So they didn't fully develop during that period, which is considered from conception to age 22. And physical disabilities are any mobility impairments or physical functioning impairments. So we also traditionally say people with sensory impairments, people who are deaf or who are blind could be within the category of physical. So in adapted scuba diving, the key is that we make modifications to the training and teaching of the activity. Then we can make modifications to the equipment. We can also make modifications to the environment or the rules and patterns of participation. So when I say the training on the teaching, it might mean that some people might need extra time to practice the skills or to get the online training done. They might need extra time for the confined sessions or the open water sessions. When I say equipment, and I have the 3 pictures here, show you kind of like tools, time, and people, because those are like usually the resources that we have when we are doing adaptive scuba diving. So in terms of tools or equipment, you can have adaptations for the equipment, such as full face masks for people that are not able to hold the regulator in their mouth, either for short periods or prolonged periods of time. You can have, in this picture, I have somebody who's using a scooter, which is a mobility aid device that can propel the person if they're not able to propel themselves underwater. And then we can modify the environment in the sense of adding ramps, lifts, things that will allow the persons to get in the environment, or even adding some particular environment underwater where they can participate successfully. So one key difference, I wanted to make a differentiation between adapted scuba and adaptive scuba. So in rehabilitation, and this is not something that is popular in scuba or even the disability world of scuba. So most programs are called adaptive scuba, but in rehabilitation, we separate adapted and adaptive. So adaptive is usually a program that requires some behavior modification or a change within the person. So think of like when the person is developing a cognitive skill. And then the third concept that I wanted to introduce, because there's a difference between those 3, is therapeutic scuba or scuba therapy. And therapeutic scuba requires a therapist, a trained therapist that is using an intervention. So usually the therapist will assess the participant, have a treatment plan with goals and objectives for them, and then evaluate the outcomes of that intervention. Most adapted scuba programs are for enjoyment or leisure participation of people with disabilities, not necessarily for therapy purposes. So moving on to the next slide, I just wanted to tell you a little bit about the certifications for different, the adaptive divers or adapted divers, and then the body divers. Can you hear me? So adaptive divers, if they're able to follow the traditional path of open water, they will go through open water, advanced, rescue, master diver. They'll do the prerequisites, which they're able to swim their 200 yards, tread water for 10 minutes. And they have pretty much the same process. So body divers are usually people that assist the adapted diver when they're diving. So as I mentioned before in the requirements of adaptive or adapted diving is that we might need more people or we might need extra equipment. So people could get certified as body divers. And there's different agencies that could provide that certification. And I'll go over some of them. So these are some of the certifying agencies for that provide some sort of training for adaptive body certification. You have the Handicap Scuba Association, Disabled Divers International, Dive Hard, SDI, the Scuba Diving International, or PADI. So each of them, I'll mention what they have advertised on their website. So Handicap Scuba Association has an adaptive diver certification for bodies. The dive, oh, my computer's acting up. I'm really sorry. The prerequisite for the dive body course is to be a certified open water scuba diver and to have 20 or more logged scuba dives. And then what you learn there is adaptations for several disability types, accessibility issues, travel specific to people with adaptive needs, special considerations for diving with a disability, transferring adaptive divers, and you have confined water training where you do disability simulations, and then open water training where you practice being in a body of 3 people assisting an adaptive diver. So you rotate in being the primary dive body with 2 different 3 people in the team. Then we have the SDI. Sorry, and I apologize because my computer seems to be very slow. Disabled Divers International. They have 3 types of certifications that people could pursue if they're interested in diving with divers with disabilities or doing more professional work. So they have the assistant diver, which is a course designed for the rehab diver is the course designed for health professionals. So physical therapists, nurses, doctors, rec therapists. Their assistant diver is equivalent to the dive body. And then the pro training, that one is, oh, I think my computer is, let me pause. Can somebody tell me if you can hear me still okay? Because my slides are acting up.
Yeah, we've been able to hear you just fine without any breaks.
Oh, so you, oh, I hear you. Let me call NSD because I do not hear anything.
Can you hear us, Tanya? Hello?
I see everything frozen and like a robot mode. So I'm not sure if you guys can hear me and see me.
Yeah, we were able to hear you just fine, and we can see your slide, but we're on the dive hard slide, but with no text on it. You want to disconnect for a minute and maybe reset your computer and reconnect? No, no worries. All right. All right, she'll be back on in just a minute, guys. Technical difficulties.
Okay, sure.
frozen now.
So as Tanya was saying, there are a few agencies. I'm certified with Dive Heart specifically. But much like any other scuba training agency, you can't really go wrong with whatever agency you decide to go with in terms of training if you wanted to pursue this type of training. And so you just about any scuba diver with some decent experience, like 20 more log dives. For me as an instructor, if somebody was wanting to become an adaptive buddy, where they are a buddy who assists an adaptive diver with anything from like transfers to gear assembly to assistance with movement in the water, anything like that, I would assess their ability in scuba diving, making sure their buoyancy is sharp and on point, because if it's not and you're all over the place and having to worry about your buoyancy, you're not going to be able to be in a position where you can help somebody else. So I conduct an assessment through that and then go through training, a lot of scenario-based training on how to help different people with different disabilities. And even within that training, you are going to only be able to go over so much, because whatever modifications need to be made, whatever adaptations need to be made are going to be very unique to whatever individual you are diving with. Christian?
It looks like Ms. Perez is back online.
Are you back on?
I'm back. I hope it works.
Okay, no worries. Well, you can pick up where I left off with Dive Heart.
Okay, so I'll start with Dive Heart, or resume with Dive Heart. It's very odd because I think it's just that I've been working on stats and heavy software. I think my computer is giving up.
Yeah, the memory can get eaten up. That's why I just restart and only have like Zoom open only.
Alrighty, so I'll tell you about this one. So yeah, I heard a little bit that you were talking about the becoming a body, and that you were a body diver. That's where I'm trying to be too. So yeah, usually the good thing about people like you is that you are already skilled in scuba diving. So if you wanted to get into the disability world and helping by being an adaptive body diver, then you can get the training. That's why I'm sharing some of the organizations that do this. So if you're interested, you can check them out, and then go with the organization that you like the best, just similar to like your open water certification. You have multiple options to pick from. And then you can get that if you're interested at all in disability. So Dive Heart has, I just included adaptive dive body and advanced adaptive dive body. They also have adaptive dive instructor, which is if you want to kind of like a train the trainer program. Dive Heart has typically 3 basic components in their certifications. Like you have a manual for the specific training, then you have an e-learning course, and then the practical portion. So for the adaptive dive body, it's an introduction to adaptive diving to certified divers interested in working with individuals with disabilities. The prerequisites for this one is that you have to have a minimum of 15 years, be a certified open water diver with at 20 log dives in the past 2 years. You need to have your CPR, first aid, or AD training. You need to be comfortable performing all of the diver's body tune-up skills, and then proficient with buoyancy. So that's why they try to recruit people that are already scuba divers, all of these organizations. And then advanced adaptive dive body, that one is if you want to go to the next level, and then it familiarizes you with more specialized adaptive diving equipment, such as full face masks. And it also allows you to work with divers that require a little bit more assistance. So for that one, you need to be 18, CPR, but instead of open water, you need to have the certified rescue diver or equivalent with at least 40 log dives. one of the prerequisites to earning that certification is that you need to get 30 experiences working with adaptive divers underwater. So they don't certify you until you have the experience working with real people with disabilities. And then 15 of those dives need to be taken or done in open water environments. So then there's the SDI from Scuba Diving International, and they have the Stability Program. That one is a program that's designed to develop the skills to be a dive buddy for specifically somebody with a physical disability. It consists of 20 hours, and you do 12 hours in confined water and open water. So the rest is educational. And for the prerequisites, you need to be 16 with parental consent or 18, your CPR certification, and you need to have the rescue diver certification or advanced diver certification with 40 log open water dives. Then we have PADI has a certification called PADI Adaptive Techniques, and that one is focused on increasing awareness of varying diver abilities. So they work for both, they teach you a little bit of physical and cognitive disabilities. And the prerequisites is for having the dive masters or master free divers and having your emergency first respond primary and secondary care scores within 24 months of pursuing the PADI adaptive techniques. So that's just, I wanted to show you some of the certifications that are specific to becoming support diver for divers with disabilities, if that interests you. So now I'll transition to why I got interested in scuba for rehabilitation, telling you a little bit about of the outcomes that research has shown so far on adapted diving, and then what I'm doing in my research study. So why did I get interested in scuba for rehab? So really, my background, as I told you, is that I'm a recreational therapist. So in rec therapy, we use leisure and recreation as interventions to help people get better. And when I discovered scuba, I was like, this really is a holistic activity that could benefit persons in multiple domains of functioning. So physical, social, and psychologically. And just as a basic, in rehabilitation, we usually talk about biopsychosocial benefits of an intervention. So for me, when analyzing scuba, just the aquatic environment in itself, it is immersive, what we call immersive therapy. And that is because we are operating in a three-dimensional environment that is gravity-free and allows for movement, easier movement for people that may have limitations in their mobility. So there is some freedom or ease of mobility for people. Then psychologically, from psychology, there's this concept called biophilia, and this is there's some evidence that nature and exposure and contact with nature has psychological and emotional benefits to people. So scuba is a really good activity for stress. It is kind of a mindfulness-like activity as well, because right now there's a hype into mindfulness-based interventions, meditation, deep breathing, and scuba naturally provides that, because when you're scuba diving, you have to concentrate in doing slow and deep breaths, and that's traditionally what psychologists will teach you when they're doing breathing interventions. It has those components that can be really beneficial to people. So there's some research on how scuba could have calming and stress reducing effects for people. And then as a social activity, it is also very powerful because the body system, literally you are trusting somebody with your life. So within that, we can say that it develops social skills, and then it also allows the opportunity to belong to this community of scuba divers. It gives you that sense of identity, community, and then just the whole piece on ocean conservation and how being socially conscious and becoming a steward for the ocean could benefit the individual beyond. Think of seeing you as thinking beyond yourself and now thinking about the environment. So we always in scuba say like, oh, I hope I find the gold and the treasure, but for rehabilitation, I think I have found the treasure. Moving on to some of the actual evidence for people, this is a specific, the physical outcomes are specific to people with physical impairments or mobility impairments. So there has been some research on helping with spasticity, aiding with in respiratory vital capacity, so improving the VO2 uptake of individuals, and then as well as for people that might have paralysis or have lost sensation on their legs or their limbs. There was a pilot study on being in scuba, doing scuba, being similar to being in a hyperbaric chamber for rehabilitation, where the aim is traditionally to help people regain some sensation and reactivity. So in terms of the psychoemotional outcomes, as I mentioned, scuba, it has characteristics that are similar to a meditative experience. So just that slow and ample breathing could be considered a meditative type of experience, on being focused and aware of everything that's around you. That's something that's also part of the activity. Then there was a study that this was specific to veterans with physical impairments and PTSD, and how scuba, and it was only one session of scuba, they did a pre and post test on their mindfulness and contentment levels, and there was a difference in that. And then for individuals with anxiety and depression that have comorbidities between a physical disability and anxiety and depression, they also had some improvements in their psychological adjustment. PTSD, that was a pilot study. And then the next one, Karen Levy and Jones, was from occupational therapy. And that one pretty much studied the psychosocial outcomes of scuba among people with physical disabilities, and how it could, it led to an improvement in their self-concept, so the way they see themselves. And when we think about it, usually when people with disabilities in mainstream society or even with healthcare professionals, there a lot of the messages that we send to them is, you cannot do this, like you're limited in this. And then for them to do scuba diving, it is an activity that, as you may know, it's a challenging activity because it requires very specific skills. So being to overcome that challenge in itself, it's very powerful for anybody, not just people with disabilities. So improvements in self-concept, decreases in stress levels, and improvements in mood. So that might have to do with the concept that I introduced before, the biophilia, which is the exposure and contact with nature, and how that could have stress reducing and calming effects on people. And then the feelings of equality to individuals without impairments, that's also a big piece, because As I mentioned before, sometimes people with disabilities may feel as less than, or we make them feel as less than. And through Scuba, some preliminary research shows that they have some feelings of equality and improvements in their self-esteem and self-confidence. So now some of the evidence on the social outcomes. So enhancing that social experience. So when you think about doing scuba for recreational purposes, you usually are talking about belonging to a club, kind of like the one that you guys have at your university, and then being able to interact with others. Within the disability community, there's high levels of isolation. So being able to be integrated in social activities is important. And these are just some of the results from some, these studies don't have strong, what we consider strong methodological rigor. They're either pilot studies or very exploratory studies, but at least there's the available evidence that we have on the benefits of scuba has been positive so far. Also developing those levels of trust within your dive body team, improving their community integration, quality of life, that's a big piece. So your quality of life is your subjective experience, or how you rate subjectively how you're doing in life and compared to all the people. So some preliminary data is that through Scuba, there have been some self-reported improvements in quality of life. And then one of the cool pieces about the social outcomes, or one of the neat outcomes that that very last one that says disability awareness and inclusion, is that the benefits are not limited to people with disabilities, but people without disabilities have the opportunity to interact with people that are different than them. And sometimes even with my students, we might not have on our daily lives the opportunity to interact with people that are different than us. So sometimes we're scared of even approaching people that are different than us. So this study also provided, or some of the themes that came up in this study were that people through scuba, through seeing people with disabilities scuba divers without disabilities were able to be more aware of disability and include them more. So now I wanted to tell you about what I'm doing in my research study. So as I mentioned before, I'm pursuing my PhD in rec therapy at Clemson University. So I'm in the very last stage. I had collected all my data, and I'm currently writing the articles for finishing the dissertation and then to submit them for publication. So my dissertation was a two-study dissertation. The first study was to test and explain the type of experience that scuba diving is among scuba divers with physical impairments, as well as their salient personality domains. So in a nutshell, what I explored in this study, because it's finalized, I'm now just writing up the results, is that I used a framework called the experience type framework. And that framework explores if a particular experience is ordinary, memorable, meaningful, or transformative to a person. So my hypothesis was that scuba diving could potentially be a transformative experience for people with disabilities. And then the secondary goal of the study was to kind of get a personality profile for scuba divers with physical disabilities. to see if they are high in any personality domain. So the big 5 domains, extraversion, negative emotionality. So I'm exploring if there's any particular personality profile. And then the second study aimed to test the relationships between being a scuba diver and levels of physical health, mental health, social health, health-related quality of life, disability level, and self-efficacy. So if being a scuba diver is related to any of those. And that's what I am doing. I cannot share my results because I asked and I cannot, but they will be coming out. So if you're interested, I will get you those. The results are very positive and interesting is what I can tell you for now. So I wanted to conclude by just telling you about some of the organizations in Florida that work with adaptive divers. So you have there a list. The list is not comprehensive. That's the people or the groups that I know. Most of them, just as a disclaimer, are in South Florida because that's where I am, South Florida or the Florida Keys. But they have, these are organizations that have something going on in terms of adaptive diving. So Aquanauts, Dive for Vets, Dive Hard, Get Tanked, Life Waters, Scuba for Good, Therapeutic Scuba Institute, and Treasure Aquatics. With that, I'll stop the PowerPoint and we'll entertain any questions anybody has.
All right, does anybody have any questions for Tania? Any feedback, any thoughts? We have somebody on Zoom?
Yeah, hello, my name is Gabor. If nobody has questions, I have 2 right off the gate. So I was very interested to hear that there are blind divers as well in adaptive diving, because diving for me is very much visual. So do you know how blind divers explain their experiences?
Yeah, so a lot of hearing. So if sometimes blind divers have a hyper developed sense of hearing. So for them, they can hear the flora and the fauna from underwater, their own bubbles. And some of them also are like the tactile sensation of the sand, or even, I mean, sometimes they're, yeah, I say we're not allowed to touch them, but they do like to touch things. And their experience, and also it's the buoyancy, you know, like it is a very physical experience. I would say as much as sensory in terms of like gross movement of like feeling that you're in space and that, because typically when we do diving for, or I don't do diving for like technical diving or scientific diving, but when you do it for occupational diving or technical or scientific, you're very focused on the task that you're doing and accomplishing that task. But when you do it recreationally, it's more about the experience. And the experience, as I mentioned before, when I was like trying to break down what type of experience is this, it really touches in all areas. So it's very like gross motor movement experience, because we're used to be just the sole fact of us going from vertical to horizontal. For some people, that in itself, it's an experience. And then just also, instead of moving in the air, moving in the water, that's also a very physical experience. So yeah, I would say for divers that are who are blind, it's not just about seeing. But for some people, because I'm also a very visual person, if you ask me why do you dive, sometimes I'm like, because I like to see things. But it's not just that, I guess. That's my answer.
Thank you.
Does that answer your
Yes, it does. It does. It does. My other question is, so if I gathered it correctly, if you're an adapted diver, you need a couple of dive buddies who are trained in being adapted diver buddies. So if you want to go on a trip or a cruise or something, you're going to have to bring additional people. It probably is going to be more expensive. Is it like, it might sound funny, but covered by insurance, or are you going to have to pay some more?
So right now it's not an official rehabilitation modality. We don't bill for scuba therapy. That's like my dream. But well, just as a basic example, the Veterans Administration just passed they have GI benefits, all veterans, and they can use scuba certifications for vocational rehab because they're considered sort of like education, professional development type of trainings. So that is one area for veterans with disabilities, they could do it. For other people, there's organizations that will fund the training of adapted divers with 1 or 2 bodies. But for the most part, people do it, from what I know, people do it because they want to help.
Can I add to that, Tanya?
Yeah, go ahead, because you
So
involved longer than I have.
yeah, no. So when someone with a disability comes and says they want to learn scuba, we take a very strength-based approach to say, let's teach you scuba, and if we have to make some modifications or adaptations along the way, then so be it, versus the deficit approach of let me see what I can teach you about scuba. And by taking that strength-based approach, there have been a number of people with both cognitive and physical disabilities that have been able to get certified with open water certification without any restrictions.
Yeah, so it's not like, so that you bring up a really good point, which is if they can get the their traditional certification, open water advanced, then do it. You don't need the bodies. But so who determines who needs the bodies? There's not like officially, traditionally, they follow the same clearance as we do. So it's like they have to get the doctor's clearance. And there's some biases from doctors also on these of like being against clearing people with disabilities, but it's more of like not being knowledgeable enough of about scuba diving. So there's a whole situation there where we tell adapted divers that if they really want to do it and their doctors is not letting them in a way, to call Dan, because they're the ones that have more of the expertise in determining if somebody is clear for diving than just any doctor that has no idea about scuba.
Yeah, absolutely. And so when they go through an assessment based on their specific needs, we do a needs assessment in terms of what modifications they need in terms of equipment, but also buddies. So sometimes somebody can get an open water certification. Sometimes they can get an adapted certification with just one dive buddy who is properly trained, especially in specifically what their needs may be. Sometimes they might need an advanced buddy or even 2 advanced buddies for various reasons. Sometimes they might need a full face mask because they're not able to keep a standard regulator in their mouth, things of that nature. So when we kind of get into this field, we know that a lot of people, like there's a hindrance, a socioeconomic hindrance with scuba diving in general across the board. But for people with disabilities, that is obviously compounded. And so for organizations like DiveHeart and Scubability, we know that once we get people in the door, they're going to want to do it more. So to Gabor's question, when you talk about like, accessibility to like go on a cruise or, go travel to dive in the Red Sea or somewhere like that, that can be very prohibitive, for people with disabilities, especially for a number of reasons, including how many dive buddies they need to bring with them. So we see that gap, and what we do our best to do, like in DiveHeart and Scubability especially, is to host events, and we do a lot of fundraising and bring a lot of money together to be able to charter boats specifically for adaptive scuba diving, and on a regular basis, anywhere from the Keys to Cozumel. Dive Heart goes out there on a regular basis. Roatan in Honduras. So a lot of nice, like, exotic locations for people to go out and experience, like, different scenarios. And so there's a lot of, like, effort behind the scenes to be able to help make those kinds of events happen so that accessibility is not as much of an issue.
Yeah.
All right, thank you.
Question.
Yes.
I'm curious to hear more on people that have cognitive deficits or neurological impairment, or even issues, maybe they're paralyzed or they come home from war and they're missing a leg. I'm just interested to see what type of research is being done to promote this as a therapy, and is there a treatment teams of, like, interdisciplinary treatment teams where you have, like, neurologists and doctors and physical therapists getting together to study, like, one case study and look at the different aspects of how this can be beneficial so that there's more opportunity?
Yeah, so this is Scuba is not highly studied, so that's why I picked it up. In terms of John Hopkins did a pilot study in 2011 that it involved an interdisciplinary team. That's the only one that I know of. But in practice, I know that a lot of the organizations are not rehab based, meaning that they didn't evolve or develop because in a hospital or with healthcare professionals, it was more of nonprofit organizations that wanted to help people with disabilities. But I'm seeing now more involvement from healthcare. So I was just last week or 2 weeks ago, my time, I don't sleep, so I don't know when was last week or the week before. So we went to a conference, the Paralyzed Veterans of America conference, and that one is the VA system puts together a conference for interdisciplinary healthcare professionals. And there was a section, like, they put us on the track for aquatic therapy because they have an aquatic therapy track, and they put scuba under aquatic therapy. And we met some people and now are trying to get it done with medicine. I am not aware of a university currently doing anything with, like, neurology or physicians in the United States. I know there was a study from depth therapy in the UK that it's the Department of Psychology with medicine, but I'm not aware of anybody here in the States other than the studies that I mentioned in the presentation. Does that answer?
It does. It sounds like there's a lot of promise, just more people working together.
It needs more involvement for sure.
Any other questions? I have one for you. So you're gonna hunker down for the next couple of months and write out this dissertation, and you defend in November, correct?
Mm-hmm.
What's next for you at that point? What are your, you had mentioned a couple of goals and dreams, like being able to bill for scuba therapy, but what are some of your other items on your agenda to accomplish?
So I'm currently a teaching faculty at FIU. So ideally, I will transition to research and will develop a research line. I want to continue with research on scuba. The one that I did for my dissertation was on people with physical disabilities, but I want to do mental health as well. So PTSD, stress, anxiety, because psychologically, I think there's a lot of potential there. And then Nesty and I have talked about neurodevelopmental disabilities. So I also have, I have done work in the past with people with autism. So that area, I think I want to explore too. but I do want, my background is in adaptive sports. So I grew up as a triathlete. So I just, I think aquatics will be, because I do swimming and scuba for now. And I think I'll just want to develop a line of research on those areas. So swimming and scuba.
Very cool. All right, any other questions or closing thoughts in here or on Zoom before we let Tania go?
Just that a good dissertation is a done dissertation. Best wishes.
All right, well, join me in giving Tania a round of applause. Great presentation. Thank you very much. This concludes our presentation for the speaker series. Thank you for coming out, and have a great night.
Thank you.